You're on mute, Dr. Armstrong. We knew that was going to happen at one point.
Welcome back to everybody. We're now starting the final section of this afternoon's symposium on nutrition and celiac disease. And this is really looking to the future. What we're looking at now over the next, probably I've got to work this one out, about the next half hour is some presentations on where we're going in celiac disease and nutrition. And we look forward to two outstanding presentations from researchers at McMaster University. It's my pleasure to introduce both of the speakers. We're going to start with Dr. Heather Galipeau, who obtained her PhD degree from McMaster University in 2015 and currently holds a position as Research Associate and Assistant Director of the Axenic Notabiotic Unit, which, for those not in the know, is a germ-free facility which facilitates research into a variety of immunological conditions and the effect of the microbiome on physiology and health. Dr. Galipeau's research focuses on notabiotic mouse modeling and organoid modeling to investigate dietary antigen and host immune interactions in chronic inflammatory diseases like celiac disease. And specifically, she's researching how bacteria modulate host responses to the dietary trigger of celiac disease, gluten, focusing on early events that trigger disease development. Her long-term objective is to develop therapies to prevent or treat chronic inflammatory and autoimmune conditions. And she will be joined in this session by Utkarshini or UK, who is a registered dietitian and a PhD candidate at McMaster University. She completed her undergraduate studies in nutrition and dietetics in India and her postgraduate work at the University of Leeds in the UK. UK works under Dr. Elena Verdu in the Department of Medicine at McMaster University, and her research investigates host microbial and nutrient interactions in alleviating the symptoms of celiac disease. So it's my pleasure now to hand over to Heather and to Utkarshini to talk us through nutrition from bench to bedside.
Okay, thank you very much for the introduction, David, and thank you to the CCA for the invitation to speak today. So I'm not able to share yet. I think you need to stop sharing.
We'll just stop sharing on our side and then you should be able to go just a moment.
Yep.
Are you there, Melissa? We just need to stop sharing our PowerPoint. There we go.
Okay. Perfect. Okay, so everybody can see the screen?
Yes.
Okay, perfect. Okay, so again, thank you for the introduction. So UK, who is a PhD student in the lab, and I are going to talk about an ongoing project that we have in the lab that we are working on in collaboration with the Celiac and the Nutrition Clinic at McMaster University, where we're really trying to better understand mechanisms of celiac disease, but moving the field forward in terms of simple but effective treatments. And so this project is a really good example of bench to bedside research. And what I mean by that is that we take discoveries that we make in the lab right to clinical studies in patients. And so I'll start with a very brief overview, as I know everyone here knows what celiac disease is, but I want to highlight some key points and outstanding questions in terms of celiac disease research that we are trying to address with this bench to bedside approach. So celiac disease is a lifelong chronic disease, and it has both intestinal and extra-intestinal manifestations. We know that the disease is driven by gluten, but there are other cofactors that are involved as well. And these cofactors and how they play a role in disease onset or progression are less well understood. And this is one key focus of our lab. And as you all know well, a strict lifelong gluten-free diet is the only treatment, but it's not a cure. And as we heard a lot about today, it's not perfect. And this has really negative impacts on the quality of life and also long-term consequences. And so, as I mentioned, there are other cofactors involved in celiac disease. And this includes the bacteria in our gut, also called our microbiota. And so we are really interested in better understanding some of these factors, like the gut microbiota, so that we can develop additional treatment strategies that target some of these pathways. And as we've heard today, there are many challenges with the gluten-free diet. It's not perfect. So for example, contamination, very small amounts can lead to inflammation. We also know that recovery in the intestine is very slow, with more than 60% of patients still having inflammation despite being on a gluten-free diet for more than 2 years. And up to 40% of patients will continue to experience symptoms despite being on a gluten-free diet. And these are what we call non-responders to the gluten-free diet. And this is a really important group of patients that could really benefit from additional treatment strategies. There's also a huge socioeconomic burden of celiac disease, so it can be very inconvenient to follow a gluten-free diet. Gluten-free diets or gluten-free alternatives may not always taste the same as gluten-containing counterparts. And as we heard earlier today in great presentations, there are also a lot of nutritional deficiencies associated with the gluten-free diet. And there could also be stress associated with dining out and traveling, and the possibility of contamination, really leading to increased anxiety and social pressures. There's also inconsistencies of labeling of gluten-free products. And as we also heard a lot about earlier today, the gluten-free diet is much more expensive. So gluten-free products can be 2.5 times more expensive. And celiac patients are eligible to claim expenses on tax returns, but it's not a simple process. And as you heard, it is based on how much you earn. And a study from 2016 showed that the average celiac household spends about $1,100 a month on food, compared with just over $800 a month by a healthy household. And so this was a few years ago, 2016, and now with inflation and rising costs, this is likely about 25% higher now. So this really suggests that we need additional treatments or strategies to help lessen this burden. And so there are many ongoing trials that are investigating alternative therapies to the gluten-free diet. And I've listed some of the more advanced candidates here. And so these do all target different pathways in celiac disease, but these are all right now being developed by pharmaceutical companies. And some of these are vaccine-based therapies or biologic therapies, and this could require, multiple injections or visits to a clinic or hospital, resulting in an expensive therapy that might not be easily accessible or available to everybody. And so while these approaches are very exciting and they do show promise, I just want to take a step back for you to better understand our approach to developing new treatments for celiac disease. And so we come in at the discovery phase. And what I mean by this is we research the underlying mechanisms of the disease, and we come up with new pathways that could be targeted and that could be targeted easily and cheaply. And then we test these pathways using preclinical models, meaning mouse models, and then in very, very small proof of principle studies in patients. And so with this in mind, we're really interested in how dietary factors or nutritional recommendations and their interactions with the bacteria in our gut could be harnessed as a potential therapeutic approach in celiac disease. And so one particular nutritional factor that we're interested in is tryptophan. So tryptophan, it's an essential amino acid. And so amino acids are what make up our proteins. Our body does not produce tryptophan, but we need it, which means that the only way that we get it is through our diet. And so some high tryptophan containing foods are things like poultry, milk, certain vegetables like broccoli, and chocolate. Once we eat tryptophan, it's broken down in our gut to even smaller molecules called indoles. And these indoles are anti-inflammatory, and And these molecules really help to maintain balance in our small intestine. So they're really beneficial for us. The tryptophan in our gut is broken down to these smaller molecules by certain bacteria. So for example, I'm sure you've heard of lactobacillus. So it's a really common probiotic, and some types of lactobacillus are able to break down tryptophan in the gut to create these indole molecules. But it's important to note that not all probiotics can do this. So it's really only specific types of bacteria and probiotics that are able to generate these anti-inflammatory indole molecules. So in collaboration with the Celiac Clinic at McMaster, we were able to look at the gut bacteria and the presence of these anti-inflammatory indole molecules in patients with active celiac disease, in healthy controls, and in celiacs who were on a gluten-free diet and in remission. And we found that in a healthy individual, tryptophan was broken down by the gut bacteria to produce lots of these indole molecules. But in active celiac patients, the pathway was impaired. So the bacteria were not able to break down tryptophan to produce indoles. So there was a lot less of these indole molecules, or these anti-inflammatory molecules. In gluten-free diet patients who had no small intestinal inflammation or persistent symptoms, we saw that this pathway was mostly restored. So this was a really, really interesting observation, but how can we test this preclinically to see if this pathway could actually be targeted as a possible therapy? And so to do this, we turned to a mouse model that we have in the lab. So we have mice in the lab that express the celiac risk genes, which are genes that are required for the disease development. And so specifically, the mice that we used express the HLA-DQ8 gene. And when we expose these mice to gluten, along with an inflammatory stimuli, these mice develop many of the same things that a human celiac would develop. So they get inflammation in their small intestine. We see celiac-specific antibodies, so those TTG antibodies. And importantly, these responses are gluten-specific. So this is a really good model where we can test novel therapeutic approaches. And we found that if we expose these mice to high levels of tryptophan in the mouse diet, or if we gave them probiotics like lactobacillus that we know can break down tryptophan to make these anti-inflammatory indole molecules, we were able to reduce the small intestinal inflammation. So tryptophan was able to protect mice from the inflammation caused by gluten. So these experiments were all done in the lab using mice or using samples that came from patients, but we showed that tryptophan, a dietary component, can improve inflammation in our celiac mice. And so these studies really provided the support and the rationale for a proof of principle study in humans that PhD student UK is now going to take you through.
Are you okay?
Yeah, sure. Just a
This
second.
might
Can
be
you
some
see my
internet.
screen by any way?
Yeah, we see your.
We can see your,
Awesome.
Yeah.
Awesome. Okay. So hello, everyone. My name is Utkarshini, and thank you so much, Heather, for introducing me. So I would be walking you through the transitional process of research, that is the actual bench from bedside research that we're going to see. So as Heather briefed you before, that the tryptophan improved the intestinal environment in the celiac mice. The next question that arises is that what about translating this in the celiac patients? So especially the ones which are non-responders to a gluten-free diet. So can these results be replicated in the target population? And if so, at what dose? Also, will this dose be safe to administer? So these are all the questions that need to be answered, right? So the first phase of this would be a clinical trial, and it is important to test this proof of principle in healthy individuals. Why so? Because in the first phase, it's always necessary to consider the healthy populations, in this case, like to see how the tryptophan would react, and also whether the 3-gram dose would be safe for such a population. So this was conducted by our postdoc student, Gaspar Rueda. So a total of 20 participants were enrolled in a randomized double-blind placebo-controlled crossover study, which means that the study consisted of 2 major groups, 3 grams of tryptophan and placebo, and all the study participants and coordinators were blinded. The participants were placed randomly in each of the groups, and they were on the respective 3 grams of tryptophan or placebo for 2 weeks. This was followed by a 3-week washout period, which was mainly done to wash out the effect of either tryptophan or placebo. And then each of the participants were then further switched to the opposite sides of the arm. And this was again followed by a 2-week intervention. At the end of the study, the urine, stool, and blood samples and biopsies were collected to examine the effect of tryptophan supplementation on these participants. So at the end of the study, we found that 3 grams of tryptophan supplementation increased the indoles that Heather mentioned earlier, which are the anti-inflammatory molecules. And the study participants that were given 3 gram tryptophan definitely showed increase in the indoles in urine and stool samples. A great news was that it did not impact any gastrointestinal or mood symptoms in these patients. And also it activated a very important and protective pathway that maintains the intestinal functions. So thus we were able to achieve the primary aims of the study, and we also could say that it was safe to intervene in the patients. So the next phase of a trial is to intervene in the celiac patients, which are non-responders to a gluten-free diet. So this forms the study hypothesis that we're currently going to talk about. So tryptophan supplementation will resolve the persistent symptoms in celiac non-responders and also restore the protective pathways. So the first aim that we have set out is that we want to observe if 3 weeks of tryptophan supplementation will improve the celiac symptoms. And apart from that, we also want to observe if this increases the overall indole production and also activates the intestinal protective pathway. So I would like to take you through the study. So this is primarily a randomized, double-blind, placebo-controlled exploratory trial. So randomized, that means that you will be randomly placed into each of the groups. And it would be double-blinded, which means that neither the study coordinators nor the participants would know which group you belong to. It's a placebo-controlled trial, so which means that you would have a placebo to compare with the tryptophan, and it's an exploratory trial, so it's something new. We have not explored this in celiac patients, so we're waiting to see how it impacts what are the results. So the participants would be the ones who are diagnosed with a celiac disease. They have to be clinically diagnosed, and they would be on a gluten-free diet for more than a year and still have persistent symptoms. And the intervention would be, as I mentioned earlier, 3 grams of tryptophan or placebo every day for a period of 3 weeks. So that means that you would have 50% chance of receiving either the drug or the placebo. So I would like to take you through the process of this study. So the study would begin with screening, which we usually term as visit 0. And usually the patients come to Dr. Pinto Sanchez. She will be screening them for the study. And once the participant agrees to be a part of the study, we will schedule the first physical visit at McMaster. Here, the participants will receive all the study instructions, dietary instructions, and will also have to sign the formal informed consent. 3 days prior to the visit 2, there will also be a pre-intervention dietary recall that would be completed. And at visit 2, you will have to complete the symptom questionnaires, provide stool, urine, blood samples, and also undergo an endoscopy, which will be performed by a gastroenterologist. After visit 2, that's when your intervention will begin, and it will be for a period of 3 weeks, where you would be either on tryptophan or placebo, and also you will have to follow a gluten-free diet along with a low tryptophan diet. Also for safety reasons, we would be giving you a phone call after like 10 days of the intervention just to ensure whether you're doing well or not. And at visit 3, this would basically be a mirror image of visit 2, and which means that all the outcome measures that we have measured would be before and after the intervention to observe if tryptophan is working or not. I would also like to mention that there would be a 2-week post-intervention follow-up just to again ensure that all the participants are safe or not. So for the intervention products, there will be an investigational product that is tryptophan. So you would have to have 2 500 milligrams of capsules every 8 hours. So for example, if you have one in the morning with breakfast, the next one would be in the afternoon, and the subsequent one would be at night. The same would be for the placebo. So we have considered leucine as the placebo. This is because it does not interfere with any of the tryptophan pathway, so it would be considered as a great placebo for the study. So you would have this question as to what are the samples and why exactly are we collecting them? So we would be collecting urine, stool, and blood samples, and this would be to measure the tryptophan and its breakdown products, that is the indoles that we mentioned earlier. Also, we would be conducting endoscopies, and this would be to collect biopsies and aspirates in the duodenum in order to evaluate the inflammation during celiac disease. And most importantly, we would also be measuring the celiac symptoms, because that's also one important factor that we are considering, that we want to see if it's alleviating the celiac symptoms or not. And we would be considering dietary recalls to ensure that you're following the dietary recommendations. And we would also be measuring the mood symptoms as well. I would like to mention that this would be before and after the intervention to make sure that the tryptophan supplementation is working. So I would like to take you to the dietary process. So as I mentioned earlier, all the study participants will be kept on a gluten-free diet along with a low tryptophan diet. So you would have to limit a few foodstuffs such as chicken, turkey, eggs, milk, because these are high in tryptophan, and there would be healthy food alternatives such as berries, fruits. You can have other beverages, quinoa, gluten-free couscous, or even plant-based milk. And the details of this would be given to you at visit 1. So the 3-day dietary recall would be 3 days before visit 2 and visit 3. And a diet survey would be sent to you through email, and then you would have to fill in the details and send it to us. This would be further analyzed by a specialized software at McMaster. So I would like to give you or show you a snapshot of how the dietary survey would look. For example, if this is sent to you, you would have to insert the specific details of your first meal, for example, what time you had it, when you had it, what particular meal was your first meal, and all the necessary details regarding the ingredients and the brand names as well. So there are a few updates I would like to give you about the study. So one most important thing is this was approved by Health Canada in August 2022. This was a major milestone that we achieved, so we were very happy. This was followed by an approval with the ethics board as well at Hamilton. And then we finally registered our study at clinicaltrials.gov. So if you want to find us out online, you can definitely go and check out the study online as well. Safety comes first for us. So all the patients will be monitored, may it be the tryptophan group or the placebo group, it does not matter. And they will ultimately be compensated up to $250 at the end of the study, and this will be based on the number of completed visits. So if you're interested in the study, please contact either Heather, or you can contact me, or Gaston, who is also one of the study coordinators. You can take a screenshot of this so that you have our contact details, and we've also mentioned our phone numbers, so feel free and contact us. And I would be now passing this on to Heather, and she can summarize and conclude our presentation.
Oh, thank you very much. So why is this study important? So if successful, this would really be a simple, affordable intervention through a dietary supplement that could improve healing and make patients feel better who are non-responsive to the gluten-free diet. You can go next. And so this is one example of a trial that we are doing with the Nutrition Center at McMaster University in Hamilton. And many of the studies that we do here at McMaster would really not be possible without the support of the Canadian Celiac Association. And so over the years, the CA has supported many members of the Verdue Lab and celiac research at McMaster through their research awards. And we've listed just some of the recipients, past recipients here from McMaster. And it's this really continued support that helps fuel and fund the research that we do in the lab that we ultimately hope is going to help patients. And so with that, thank you very much for listening, and we will be happy to take any questions now.
Thank you very much indeed, Heather and UK, for very informative and fascinating presentation.